Hello, DPS family, and Happy New Year. Dr. Steve Federico, pediatrician at Denver Health, here to talk more about COVID. Unfortunately, we're starting the new year with a tremendous number of cases in our community. This is mostly due to the fact that the new variant, Omicron, is highly transmissible. So there are a lot of cases. Our test positivity is incredibly high. But fortunately, Omicron does not seem to be as severe as its predecessor, the Delta variant. It's not to say it's not a serious illness, but thanks to high vaccination rates in Denver and the changes in the Omicron itself, fewer people are getting severely ill, and fewer people, as they get sick with COVID, are needing to be hospitalized. Unfortunately, those who are unvaccinated continue to have significant complications, and those are the people that are more likely to be hospitalized and have bad outcomes. Now, as we look to the second semester, with our current rates of COVID, I think it's highly likely that schools will have to have some periods of time, perhaps 2 or 3 days, where we will not be able to have the staff to run every single school every single day. What I would say as a pediatrician is that I think it's really important that we prepare our kids, our students, for this possibility. We know that they suffer tremendously developmentally and from a mental health standpoint from the social isolation of not being in school last year. And for a lot of our kids, a sudden change from in-person to remote could be problematic. I am optimistic that we will not have a prolonged period of remote learning. But I do think it's likely that many students will have some short periods. And so I think it's important as a parent to early on, starting now, tell your students this is possible. Make sure they're prepared. Let them explain to them why it might happen. Make sure they're supported when they're at home. Make sure they're able to connect with their teachers, get their work done, and reassure them that it's likely to be short-term and we'll get them back as soon as possible. So last week, the Centers for Disease Control, or CDC, released new guidance around COVID. And this has to do with the data associated with Omicron as we learn more about this variant. The first thing that we learned is that the period of time when a person is most likely to transmit it to somebody else are the 2 days prior to symptoms and the first 3 days of symptoms. So as a result of that information, the CDC changed its guidance to say that if you test positive for COVID, usually on your first or second day of symptoms, then you need to stay isolated from everybody as much as possible for 5 days. 5 days after your positive test, if you are no longer having fever and your symptoms are improving or markedly improved, you can then return to school or your community, but need to be masked for the subsequent 5 days. Fortunately, in our DPS community, that's not an issue because everybody's masked almost all of the time. So unfortunately, there's still a lot of things about COVID we don't understand and we don't know. But there are a lot of things we do know. And one of the things we do know is that our mitigation strategies in schools work. We've been very lucky to have a strong team in DPS that has supported our mitigation measures, most importantly, masking, staying home when we're sick, and getting as many people vaccinated, fully vaccinated and boosted as possible. It's pretty clear that these things matter, even with Omicron. Even though our rates are high and we do see breakthrough cases, the severity of disease is much less when recently vaccinated or boosted. Now our 16-year-olds are eligible for boosters. So teachers, staff, and students above the ages of 16, if you are not boosted, please do so as soon as possible. We are likely to have boosters for 12 and above, perhaps as early as next week. Boosters matter, and if you're not vaccinated, please consider getting vaccinated as soon as possible. This will decrease transmission and decrease severity of COVID in our community. But again, staying masked and staying home when you're sick and getting tested as soon as you're sick are also crucial to our success. This was seen over and over again in the fall. We were good at it. We will continue to be good at it. Thank you for your support in doing these things. Testing remains a complex question. Fortunately, folks have gotten the message that testing is important. Now, what's clear is that testing has the greatest value when we test people who have symptoms. So if you have symptoms, get tested as early as possible, whether that's a home test or test with the healthcare provider. That's the greatest value of testing. Now, why are we not requiring negative tests within DPS? The first is that because testing is only as good as that moment. A negative test can be falsely reassuring, especially home tests when it comes to people who are not symptomatic. There are a high rate of false negatives of people testing when they don't have symptoms with home testing. The second is that testing availability across the United States, across the world, is extremely strained right now. Products to do testing in hospitals, home test kits, and so would not be practical to test everybody all of the time. We would just simply would not have the capacity to do that. And the third is we know that transmission in school because of masking and other mitigation measures remains unusual, remains rare. And thus the added value of negative test probably adds very little to the safety of our environment. So test when you're sick, isolate when you have symptoms, and wear your mask and get vaccinated still remain our key mitigation measures and those with the greatest amount of evidence.